Why do I think every department needs a drug recognition expert? Well, I'll tell you. I got my problems with the drug recognition expert protocols. I've done a separate video on that. That's not this video. And remember, drug recognition experts are those officers with additional training and additional certification to help determine whether or not somebody is likely under the influence of a specific drug category. So we're talking about impaired drivers here. Now, one of the things that I see officers testify to a lot incorrectly is officers with just the standardized field sobriety training will testify that someone high on cocaine or high on meth or high on hydrocodone or high on marijuana had 6 out of 6 clues on HGN. Or they'll say somebody with a low blood alcohol like 0.02, 0.03 had 6 out of 6 clues on HGN. Or somebody that had a 0.02 alcohol and smoked a little bit of weed had 6 out of 6 clues on the HGN. Remember that HGN is the eye test where the eye involuntarily jerks as they're moving their finger across. And so they're taught in their training that 4 out of 6 or 6 out of 6 clues means that someone is impaired by alcohol. So if the officer thinks they see impairment on anything, then they think they should see 6 out of 6 clues. And I'm not saying that they're lying. I'm just saying that sometimes we see what we want to see. If they think you're impaired, then they may see it. A DRE, if they were out there on the street, get called out, then they would do a medical rule out, because a DRE with that additional training would evaluate them and say, no, that HGN is not being caused by alcohol, cocaine, heroin, or the marijuana, because none of those things cause HGN with the alcohol at a lower level. None of those things cause HGN. Now, alcohol at a higher level can cause HGN, but even mixing alcohol with those others do not, because it gets something called a null effect. But a DRE would know that. An officer with 3 days standardized field sobriety training would not. So DREs are helpful to do medical rule-outs or not impaireds. And I have seen that happen on their rolling logs, and I've had a couple of cases where arresting officers went ahead and made the arrest, even though a DRE called a medical rule-out. So it's helpful to have those DREs to help keep innocent people innocent, because I also see attorneys not ask those questions because they haven't had the training. I see prosecutors that haven't had the training, judges that haven't had the training, which means if those people have not had the training, innocent people can get convicted. And that's not good.